All right, let's get started. Hi, my name is Ike Hasley. I am a resident physician in the Department of Physical Medicine and Rehabilitation here at Mayo Clinic in Rochester, Minnesota. This is a Charter House lecture series, and it will be going out on March 8th, 2021. And the title of this is called Exercise in Older Adults. Before I get started, I'd like to talk a little bit more about my specialty, which is within the Department of Physical Medicine and Rehabilitation. So my specialty, PM&R for short, or physiatry, we are a very broad specialization. So we focus on a lot of different things that really affect physical function. So this can be mostly neurologic or musculoskeletal issues, ranging from falls that result in a traumatic brain injury, strokes that occur, other sort of head injuries that can affect the way you physically get around or think or talk. And so we specialize in the rehabilitation of people who suffer those injuries. It could be a spinal cord injury, whether you had a surgery, or a traumatic spinal cord injury, how to function in life, living with that. Or it could be more of a musculoskeletal related issue, whether you are pretty healthy and you maybe tore your rotator cuff, how we can get you in with our physical therapists and get some rehabilitation with that, or other injuries, or sort of musculoskeletal issues of that nature. And so I'd like to just give my background on that, as I think that provides me with the expertise to talk about this issue. So let's get started. I do not have any disclosures or conflicts of interest. However, I do have a disclaimer. This talk is not meant for medical advice. Instead, it's more of an educational piece. And I do recommend that before you change or start any new type of physical exercise program, you do consult with your personal primary care physician before doing so. So let's go over the learning objectives today. Upon completion of this lecture, participants should be able to, 1, outline the basic physiologic changes that occur with age. 2, describe the various benefits and importance of exercise. 3, demonstrate examples of a well-rounded physical fitness regimen. So to start off, why does this topic matter? Why does exercise matter? Why does exercise in aging individuals or an older population matter? Well, it's because our population is aging indeed. This graphic is from the United States Census Bureau and the Department of Commerce, and it's called an aging nation. And so if you take a look at this line graph here, the blue is adults over 65, while the orange is children under 18. And the line graph demonstrates the percent of the projected population. So over in 2016, adults over 65 made up only 15%. And right around 2034 or so, they overtake the previously higher population of children under 18. And from there, they simply separate. They go the opposite way as we go on towards 2060, where the projected population is going to be 23% of adults over 65% and only 19.8% of children under 18. The bar graph underneath it is demonstrating this in millions instead of percentage. And again, it shows something very similar where that crossover happens around 2034 and continues to expand after that. And this is mostly due to people being aware of healthy choices and technology that keeps us older and fitter and happier for longer. This is another graph that shows a similar type of message. So it's called From Pyramid to Pillar, A Century of Change. In 1960, we have younger individuals at the bottom making up a very large portion of the population, and older individuals at the top, and it's shaped in that pyramid type of shape. If we look forward 100 years to 2016, This is no longer a pyramid, but it's rather a pillar shape. And as you can see, there's still quite a lot of individuals that are younger, but our population is growing, and therefore the top of that pyramid is more spread out. And as you can see, there are more females than males, which is probably an indicator of the fact that females are known to live longer than males by at least a couple of years. And lastly, this is kind of a demographic of some of that information that we just talked about. So this shows the percent change among 65 and older populations. So purple means that that percentage is growing by a very high rate, and the less purple you get means that it's still growing, but just at a lesser rate. And the green means that there is a decrease in the older population. So kind of this migration outside of this middle strip of the United States. But as we can see here in Minnesota, still growing quite heavily at greater than 60% rate change. As you can see, the coasts are absolutely filled out with purple, and it's very rare that we actually see a decrease in those that are older than 65. So that's just some background on why this is going to matter. Moving on from the importance of this to more physiologic changes with age, well, there's some bad news that is associated with that. Although you may be getting more experienced and wiser, there are some physical effects that aren't necessarily positive things. So starting with the pulmonary system, you have a decreased maximal pulmonary function. So you're simply not as able to exchange air as you once were, no matter how fit you are. You have a decreased maximal cardiac output. One way that we determine maximal output for an individual is by subtracting their age from a subjective number like 220, and that's your max heart rate. And going along with max heart rate is your cardiac output. You have increased insulin resistance, meaning you're at an increased risk for diabetes, increased blood pressure, increased cholesterol, and there's cardiovascular effects that come along with that. Moving on to the musculoskeletal system, you have decreased muscle mass and bone density. And although these decrease over time, and there are these negative effects over time, as we're going to see on the next slide, these can be slowed if we do stay healthy, active, and exercising. So what do these changes mean? These mean that we have an increased risk of various bad things overall. There's an increased risk of osteoporosis and related fractures, increased risk of falls associated with fractures, increased risk of traumatic brain injury, which is what my specialty sees quite often in the rehabilitation unit over at Mayo near St. Mary's. There's an increased risk of depression, back pain, infection, as well as multiple other comorbidities, including cardiovascular related comorbidities and stroke. So what is the good news about all of this? Well, there's some bad news. The good news is nearly all of these risks can be reduced or mitigated with exercise. So why should we exercise? Well, to reduce those sort of risks that we just talked about. Regular physical exercise in older adults has been shown to improve the following: strength, range of motion, balance and coordination, and risk of cardiovascular disease, stroke, hypertension, obesity, and type 2 diabetes. Some of those things that we just talked about on the previous slide. Looking into these more specifically, aerobic exercise, which we all know about, that's more cardiovascular exercise. This has been shown to lower resting heart rate, lower blood pressures, both systolic and diastolic blood pressure, improve muscle oxygen uptake, increase the VO2 max, which is how well our body can exchange oxygen. It has cardioprotective effects, and it has a decline in, or a slowing in the age-related decline in bone mass density. going along those osteoporosis type of side effects that we talked about earlier that are associated with aging. So that's the aerobic exercise part, the cardiovascular training type part. But as many of us know, or at least we will know by the end of this lecture, a well-balanced exercise program consists of both aerobic exercise and resistance type training. So what does resistance type training provide for us? This can improve muscle force, power, and endurance. It increases bone mass density, improves body composition, increased muscle cross-sectional area and volume, and decreased body fat. And some of you might read that or hear that and say, well, I don't really care exactly what my body composition is like, but we're going to get to that in the following slides and why that can be important. Other things that exercise helps with: balance. It decreases falls and fall-related injuries. So again, when I mentioned the rehabilitation unit down at St. Mary's, unfortunately, a lot of people coming in, it is due to falls, whether that's a traumatic brain injury, a fall that causes a central cord syndrome, which is an injury to your neck. There's various reasons. It can cause fractures, and we certainly see people for things like that. Stretching increases the joint range of motion, and it also increases flexibility. And this just makes you more able to get around in everyday life, decreases your chances of becoming frail. So going back to osteoporosis, there have been multiple studies that have shown that regular weight-bearing exercise, and that even includes things like walking, such as walking 30 minutes or more about 3 times per week, decreases the risk and progression of osteoporosis. What do you do when you decrease osteoporosis risk? Well, therefore, you decrease the risk of having a hip fracture that's associated with falls. So low back pain is very common. It's not only common in the United States, it's common across the world. It's common in young people, it's common in elderly people, but we do know that the risk can certainly increase with age. Again, there have been multiple studies that have demonstrated that fatty infiltration of the surrounding muscles in your back or spine are associated with increased low back pain. So this is what I was referring to earlier when I say, well, I may not care about the way that I have body composition, or I don't necessarily care about my muscle mass, but it has been shown to be important. This is an MRI of a patient that I've seen on the left here. As you can see, these are her back muscles, left and right here. So this is towards the back at the bottom. This is the patient's right over here where my mouse is, the patient's left over here, and this is the front of the body. These are the vertebral bodies, spinal cord, and this is the back of the spinal column. And like I said earlier, these are the surrounding muscles. As we can see here, there's some white infiltration of these muscles. And what that white infiltration is basically is fat. So with increased fat, you have a higher chance of having low back pain. And as we know, low back pain can be quite debilitating and really affect someone's quality of life. If you compare or contrast that to the image on the right here, this may be at different levels of the spinal cord, but I think that the picture comes through. It's darker here. You don't see quite as much white infiltration or fatty infiltration as you do on this image on the left. So again, we've got back over here. The back of the person is over here, right, left, in front of the person. Spinal column. This is the person's spinal cord in the back of the spine, and these are the surrounding muscles. And again, you can see the difference in the color or the brightness here. So going on to the topic of frailty, it has been shown that low physical activity is associated with frailty. There have been multiple studies on this, and this is actually currently a highly studied topic out in the literature. Again, for those reasons that I listed earlier, with the aging population of America and the world in general. So that's why this is a hot topic of study. So a 2015 systematic review, and when I say systematic review, this is a study that looks at a lot of different studies and combines them together and say, well, what did we learn from these multiple 5, 10, 20, or 30 studies? What did we really learn from all those when you put them all together? So this was a 2015 systematic review, and this suggested that frail older adults would benefit from exercise interventions. So talking about depression, this is again similar to low back pain or frailty. This is very common in not just the elderly population, but the population in general at all ages across all spectrums, whether it's in the United States or elsewhere. And again, this can certainly increase the risk of depression can increase with age. One study was a 2019 randomized controlled trial, and this demonstrated that aquatic exercise programs reduced depression and anxiety. So it improved mental health. It also improved functional autonomy, as in independence and getting around on your own in everyday life, and decreases oxidative stress in depressed elderly persons. So now the question is, we know all these good things about why exercise is so good for us. We know that we should be doing it. So why don't we exercise? Again, kind of on the similar topic of this can increase with age. And the point of this topic is to try to mitigate those risks. So why don't we exercise? Well, about a fourth of us, 27.5% of United States adults 50 and over, or approximately 31 million people, self-reported as inactive. Again, the prevalence of inactivity increases with age. Those between 50 to 64 years, this was associated with a 25.4% chance of reporting as inactive. And that goes up 65 to 74 years old, increases to 26.9%. In those 75 years or older, this increases to 35.3%. So some of these pictures, well, why don't we exercise? Well, it's kind of that couch potato idea. You're used to sitting on the couch and watching TV all day, and that's what you do. And then when you do get up, your joints aren't used to it, and your muscles are aching, and so that's why you decide that I better get back on the couch. And so that's kind of this good habit, bad habit type of thing. The blue is the good cycle, where if we get up and we get out and our body likes getting up and moving around and staying active, we continue to do that because it feels good. Whereas the red says, this is the vicious cycle where I don't like moving around and I want to keep moving, or I want to stay stagnant and stay still and stay on the couch. And that becomes kind of what we're used to. And that's why I bring up the cover of this book by Charles Duhigg. This is called The Power of Habit. And this isn't necessarily as scientific of studies that we in the medical literature may pursue, but he goes a lot into why habit is so effective, and that we really are creatures of habit, and that we propagate ourselves in a positive light when we do good habits, and those are just part of our days. Whereas if we fall into the spiral of having bad habits, then we propagate the other way, kind of like that the cycle analogy that we just used earlier. So what are some recommendations for a well-rounded exercise plan in older adults? This is straight from one of the textbooks that we use frequently here in physical medicine and rehab. And I know it's a lot to look at, but I'm just going to kind of break it down by section. And again, this isn't necessarily specific medical advice. Obviously, if you have cardiovascular issues, then you should take that up with your doctor. Or if you have osteoporosis already, you need to discuss what are my limitations for weight-bearing exercise, and what should I be doing more and what should I not be doing necessarily. So first, the type of exercise is listed on each of these subcategories. So up top, we have aerobic exercise. In a general catch-all recommendation would be to do continuous exercise, whether that's running, walking, cycling, rowing, or swimming, about 3 to 5 days a week. And when we say moderate or high, this is measured in VO2 max. But a lot of times people can usually figure out what a moderate or high level would be for themselves. How long should you be doing this for? Well, 30 minutes for moderate exercise, or if you're doing more vigorous exercise, that would be about 20 minutes or so. And this doesn't necessarily have to be all at once. There have been studies that show that you can do these in bits and pieces. Some people get a little bit intimidated by saying, well, I don't think I can walk for that long, so if I can't do 30 minutes, I shouldn't do any. But you can certainly walk for 10 minutes, then take a break, sit on the bench out in the park, walk for another 10 minutes, and then keep that going. The next type of exercise is resistance exercise. They give examples such as free weights, resistance bands, or progressive resistance exercises combined with power training. This can be done approximately 2 to 3 days per week. You can start low at about 40% of what you think you can do and eventually progress to moderate or higher. These can be done in 2 to 3 sets of 8 to 12 repetitions, and you should address the big major muscle groups that you use each day. So starting down at your feet, the muscles around your ankle joint going up to your calves, your knees, thighs, and hips. Your core is certainly important, as well as your shoulder muscles, because we use our hands out in front of us and reaching up high, reaching to the side, things like that. I will say that they do say to do 2 to 3 sets of that, but there have also been studies that Dr. Laskowski, he's one of the experts in this field, not just at Mayo, but therefore worldwide as well. He likes to talk about studies that have shown that if you just do 12 reps max, one set, instead of having to do 3 or 4 or 5 sets like you might hear, just doing that one set may provide just as much strength as doing multiple sets. For the next type of exercise, we have flexibility. So static stretching, this would be preferred over ballistic stretching. So bending down, stretching those hamstring muscles right before you feel any discomfort, as we don't want you to be in pain, and holding for about 30 to 60 seconds. Studies have shown that you should do at least 30 seconds in order to really lengthen out those muscles, which is what you're working for, so that you can avoid things such as body imbalances, tendon injuries, things like that. Again, this can be done about 2 to 3 days per week. Lastly, a balance exercise is recommended. This is called proprioceptive training. And by proprioceptive, we mean, where is my limb in space? Or where is my foot in space? Can I close my eyes and realize my foot is slightly out to the left compared to my other one? This can be agility training, gait, Tai Chi, which has been shown to provide numerous benefits, yoga, progressively more difficult postures, and things of that nature. Again, this can be done 2 to 3 days per week. I just wanted to share this news article. This was by Michelle Crouch in the AARP. This is from October of 2019, called Inspiring Stories from Later in Life Athletes. And basically what this does, this can certainly be Googled, or I'd be happy to provide this reference to anyone who is curious. This goes through various kind of ultra elite elderly athletes over 65. And she says, from triathlons to trapeze, new challenges open doors. And I just wanted to make the point that, it's never too late to start a good habit, whether that's for me or for someone younger than me or for someone older than me. You can always start a new habit, and so that's the point that I want to get across. These are my references, and I'd be happy to take any questions that I can answer to the best of my ability. Thank you.